Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Think of the endometrium as the fertile soil where the embryo must implant. Each menstrual cycle, this lining grows, matures and sheds, all under the influence of estrogen and progesterone, these two important hormones. But if the balance between these two hormones is disturbed, implantation and pregnancy can become difficult. So first we need to look at the role of estrogen. It's for the building of the lining. The first half of the menstrual cycle, which is called the follicular or the proliferative phase, is dominated by estrogen, which is produced by the growing ovarian follicles. Now what does estrogen do? It stimulates the endometrial cells to multiply, increasing the thickness of the lining. It also enhances blood vessel growth, ensuring that the uterus gets good oxygen and nutrients. It helps the lining develop the characteristic triple line pattern that we look for on ultrasound before ovulation. Estrogen also increases receptor sensitivity, preparing the tissue to later respond to progesterone. So, in summary, estrogen builds and beautifies the endometrial bed to make it ready for the next phase. What is the role of progesterone? It's to mature the lining. After ovulation, the ruptured follicle becomes the corpus luteum, which secretes progesterone. Now the endometrium enters the secretory phase. Here's what the progesterone does. It stops further growth of the lining and starts maturation, making it soft, receptive and rich in nutrients. It changes the glands inside the endometrium to secrete proteins and glycogen, which is the food for early embryo. It alters the immune response or the immune environment to become more tolerant so that the body can accept the embryo. It closes the window of implantation at the right time. So, too little or too much progesterone can reduce this window. So, while estrogen builds the house, progesterone decorates it and makes it ready for the guest, which is the embryo. When hormone balance is disturbed, what happens? Estrogen and progesterone levels are not ideal and this can affect fertility. Low estrogen leads to thin lining, which is less than 7 mm, poor blood flow and lower implantation rates. Excess estrogen without progesterone, which is an unopposed estrogen, can cause irregular bleeding or endometrial hyperplasia. What happens when there is low progesterone? It results in low or non-receptive lining, early shedding or luteal phase defects, which may cause implantation failure or early miscarriage. This is why in fertility treatments like IVF, we carefully monitor hormone levels and supplement them when necessary. So why is supporting hormones in fertility treatment important? Estrogen tablets, patches or injections are used to build the lining. Progesterone injections, gels or capsules are important to support implantation after transfer. This will mimic the natural cycle, giving your uterus the same environment which it would have in a natural conception. If you wish to know more about this, please feel free to contact us. Thank you.